Hey, good morning, everybody, and welcome to the County Executives Media Conference for Tuesday the 2nd. We're going to hold for just 1 second as we wait for everyone to join us. So bear with us for a minute. Looks like our friends in the media are getting connected. Give it a few more seconds. And if we can ask folks in the media to keep their video off for the first bit of the segment. We'll open it up for questions and answer after our presenters are done. So it looks like we're generally connected now, so I'm going to go ahead and get us kicked off. I'm Chris Trumbauer with the County Exec's office. I'm filling in for Roz this morning. She's having some internet issues, and so I'm filling in for her. But it looks like we've got everybody, so we're going to get started. And first up is County Executive Stuart Pittman.
Thank you. Thank you for joining us, everybody. I'm going to first thank our Department of Public Works crews for being out there on the roads, not getting a lot of sleep in the last couple of days, but I'm told that all of our roads are passable, that all of our collector roads and main roads have been plowed thoroughly. Residential streets are passable. We've done 5,200 tons of salt and have 11,400 tons available in stock right now, and used 4,000 gallons of brine to treat our roads before the storm and have 18,500 gallons of that on hand. So thank you to them. Thank you also to our trash collectors. Some of you may not have had your trash picked up yesterday. They were working and it was slower. They'll be picking up trash today, and some folks might have their trash picked up a day later than normal. They'll be continuing on Wednesday. So thank you to those folks as well. The weather has caused some changes in our vaccination appointments, and people should check their emails, but Pam Jordan will be talking about that in a minute, exactly what we're doing to shift that. So on COVID, Dr. Kalyana Raman will talk about the metrics and go into much more detail, but I do just want to say that I believe we did the right thing last week when we lifted some restrictions. The numbers were starting to go down and they're continuing to go down. So I am thrilled. I think the best news I've had this week was in our weekly call with our two hospitals when they each reported on the number of COVID patients that they have in the hospitals, and it added up to just over 80 when we were closer to 160 just a few weeks ago, and rising. So that is a huge sign of progress. Our numbers are down so that we're closing in on 30. We're about 31.6 yesterday, I believe, in our cases per 100,000, 7-day average, and our positivity rate down to pretty close to 7, and our infection rate at 0.83. If you remember, 1 is when we're likely to keep our numbers. So our numbers are likely to be dropping because for each person who has COVID, fewer than one person seems to be getting infected. So that's an important metric as well. But we, of course, have to stay vigilant and keep pushing our numbers down as far as we can possibly get them. And of course, vaccination is part of that strategy and part of what's going to be bringing our numbers down in the future. The news there is not as good as I would like to report in terms of allocations and availability of doses from the state and the feds. The state did have an increase. They were getting about 72,000 doses for a few weeks, and they're up to projecting this week 88,000 doses. Last week was actually, even though Anne Arundel seemed to have been cut, and most of the big central Maryland counties were cut through their health departments and allocations, there were 110,000 doses to Maryland last week. Unfortunately, that number is not continuing right now, but that's what the State Department of Health reported. The strategy that the state has used is to move towards pharmacies and next to move into large sites that the state would run, 6 sites around the state, mass vaccination sites. So what we're looking at in Anne Arundel County this week is getting 3,400 doses for our health department. We were getting 5,000. We got 3,000 last week, but Anne Arundel Medical Center transferred 2,000. So we had 5,000 last week. This week, we're expected to have 3,400 first doses. The Anne Arundel Medical Center had been bumped up from 1,000 to 5,000 last week, and very kindly agreed to transfer 2,000 to make up for appointments that we had scheduled. So they were at 3,000. And this week they're back down to 1,100. And Baltimore Washington Medical Center, fewer than that, closer to 100, we're told. And then of the pharmacy plan, Giant is the only pharmacy in the state's plan that has sites in our county, one in Anne Arundel, one in Baltimore, one in Glen Burnie. And they don't give us data on how many vaccinations will be provided to each site. But we're told that last week, Giant had 5,000 statewide, and this week that there will have 10,000 statewide. And we figure we're about 10% of the state population. We have about 10% of their locations. They have 22 statewide. So we can figure that there could be this week with 10,000 total, that we could get 1,000 doses into Anne Arundel County residents through Giant. We don't know how that's going. Last week, their site crashed, so we're hoping that that's moving forward. And then the other one that I know our residents are hoping for is Six Flags. That's the closest of and the first of the state sites, mass vaccination sites that will be open. They have not put a registration portal up, at least had not as of yesterday. I haven't heard that they had. Somebody can correct me if I'm wrong. And they have not announced how many doses will be available at Six Flags. So I am sympathetic to all of our residents who are out there trying to get a vaccine. We have recommended that our central pre-registration site be used so that people don't have to register at each one of these. That has not happened yet. Some of you may have listened in yesterday to the Senate's, the Maryland Senate's hearing with Secretary Schrader. They were echoing the things that we have been saying about how important it is to first send doses to local health departments whose ability to get doses into arms fast has been higher, faster than any of the private providers. And they're the only institutions that can do it with a real plan to address vulnerable populations, underserved populations. And so we're going to continue advocating for that. We hope that in future weeks, more doses get sent to local health departments. Let me jump straight to, well, on the, there's the equity issue by county, which we have talked about quite a bit, because from the numbers that are published, clearly the large central Maryland counties get fewer doses per person, per population than the outlying smaller counties. And the Maryland Department of Health has committed to trying to correct that and to try to get more doses, to try to do it by population. But the other equity issue that we've talked to the state about and we've been talking about is equity by race, by income, by community, and even among our 110,000 residents who have registered for a vaccine. If, for instance, in the 75 and older age category that we're prioritizing right now, white people are twice as likely as African-American people to have registered on that site. And so we are working with our Health Equity Task Force. Dr. Kellyanne Rahman may have some things to say on this to reach populations that are not registering, get people vaccinated. We'll work with the state on their Go Vax campaign to build trust. We'll work with the Anne Arundel County Caucus of African American Leaders as well, and work hard to get the vaccinations into the arms of people who are the most vulnerable. And we believe that that's important. That's something that only local health departments are willing and able to really do. So and the final part of all of this is that there is $400 million in federal money that Congress approved back in December that is to be used for COVID mitigation, vaccination, and contact tracing. So far that money has gone to the state of Maryland, but we have not heard how our county will get access to those funds. So we and our friends in the General Assembly are working on trying to get that information and encouraging the health department to move that money quickly and with as little regulation as possible. So let me jump to the issue of teachers and school reopening. The school board has some tough decisions to make, of course, and I have been supportive and continue to be supportive of following the science. And the science is telling us that schools can reopen and that spread within schools is less likely than we thought it was early on when all the schools had been closed. But I have committed, and I have, Nilesh can tell you that I harass him regularly with the question of when can we get our teachers vaccinated? Let's get started. Let's get started. We need to get our teachers vaccinated, not only so that they feel comfortable teaching in our schools, but so parents as well feel comfortable sending their kids to school. I think most people know that when the survey went out, it was about 50-50 in terms of which families are going to are ready to send their kids back in March and which ones are not. And part of that is based on whether they believe that it's safe. And so when I ask Nilesh when we can start allocating our doses to teachers, I'm always told, yes, we want to, yes, we will, yes, it's important, but we have a lot of 75-plus-year-olds who are very, very vulnerable right now. And so that's the place where we're in is saving lives versus getting our teachers vaccinated. And Nilesh will talk about how that's all going to work, but that will start next week, is vaccinating both our public and our private school and our childcare educators. The systems are different for them because it's just a logistic question, but we're not leaving out private, some of whom are already in school when we do our educator plan. In General Assembly, our team is monitoring about 600 bills. I did a briefing both this week and last week to our county delegation, and we're working closely with them and looking out for our interests, particularly our economic interests in the county. And then finally, you may have noticed a small thing go through in the county council among maybe more controversial and sexier issues was a contract that the council will need to approve that we have negotiated with Amoresco Incorporated to do solar panels on the Glen Burnie closed landfill site. And this has taken a lot longer to negotiate than we thought it would. Everything in government takes time, but we're thrilled that this is a project that will create $3 million in revenue for the county, power 450 homes, equivalent to 450 homes. And it's just the beginning of a county plan that our environmental policy director has been working on to identify sites and opportunities and review our existing laws to increase the amount of renewable energy that we produce, solar energy in particular, that we produce in Anne Arundel County. And then finally, yesterday was the beginning of Black History Month. And you may have seen on our Facebook page that there was the first in a series of stories of Black history from Anne Arundel County all over Anne Arundel County. So there will be, I believe, a couple per week, and they will be from every district of this county. And I just want to say that it's an effort. Collecting these stories has been done by our team, Roz Hamlet, who you know, our team at Community Engagement Constituent Services, also some important help from Janice Hayes Williams, who's our local historian of note, and that I personally love Black History Month because I always learn history that I didn't know. And I think these stories will tell people things that will encourage everybody to reflect on the history in this county of the experience, of African-American experience since enslaved people were brought over to this county hundreds of years ago. And it's important as we move forward and try to remove the institutional racism that still exists in our government for all of our residents to understand where we all came from. So thank you. And I will turn it back to, I guess I'll turn it over to Chris or Nilesh.
Dr. Kelly Narman.
Dr. Kalyana Raman, yes.
Thank you, County Executive.
We're all getting pretty friendly here.
Yeah, you know. I just want to start off with our data as we usually do. As county executive noted, our numbers are getting better. We've seen that our case rate is coming down. It's now down to 29, and it's nearly 3 weeks of a continuous decline, 20 days to be exact, which is exactly what we wanted to see and exactly what we would expect from the restrictions that have been put into place, and we expect that to continue going down for a little bit longer. We've always talked about the fact that it takes a couple of weeks for changes to register. The restrictions took a little longer because we had the complicating factor of the holidays, but it did register in our case rate, as you can see. So we'll see what it does over the next few weeks. But most critically, our hospitalizations are going down. Our hospitals are in better position. Seeing a continued decrease in both the acute care and the ICU census between the hospitals, and that's really encouraging. We've seen over close to 90 deaths in the month of January, and we expect those deaths to continue for a little while longer because remember that lags our decrease in case rate. But we do expect our percent positivity is coming down as well, down to 6.7 now compared to 7.4 last week. So that's a really good sign. Just one caveat, our percent of population tested was at 4%, down from 4.5% last week. So there are fewer people getting tested. But that said, the percent positivity is coming down as well. So that is a good sign. In terms of vaccines, we are seeing that in the county, 47,000 vaccinations have been done, 39,000 first doses, and 8,000 people with a second who got both doses. And those are largely from the hospital standpoint because they were the first ones to get vaccine. The health department has done 20,000 people with the first dose and then 1,000 people with both doses. As we've noted before, we're using up all of our supply pretty quickly. We've used up pretty much everything that we've gotten. And if not for the weather, we'd be chugging along yesterday and today. We've had to make some adjustments, but I particularly want to highlight something that we had to do. We knew in advance that we would have to cancel the Monday clinics, vaccination clinics. We were hopeful that we'd be able to keep our Sunday open, but it became pretty clear Saturday afternoon that we were going to have trouble with getting folks into the Sunday vaccination clinic. And so folks at the health department, aging, the CE's office all came together to figure out how to set up a unscheduled vaccine clinic from 4:30 to 7:30 on Saturday evening to try to get all of those folks who were scheduled Sunday morning vaccinated on Saturday before the snow hit, and also to make sure that we didn't waste any vaccines. The way the Pfizer vaccine works is that once you thaw it, you have 5 days to give it. So if we didn't do that on Saturday, we would have ended up having to waste doses, and of course we are not going to do that. So it was a pretty amazing effort to get the logistics down, to make calls, and I know that aging and others were making calls to all those seniors who were scheduled on Sunday morning to get them scheduled in that afternoon. So I just wanted to highlight that story. As the county executive noted, we've had to make some changes to scheduling, and I'm going to let Pam Jordan speak about that once I'm done. A lot of rippling changes because of these weather conditions and closures at the community college. We are going to be starting educators, and that means public school, private school, and childcare next week. What we know from the numbers is that in our county, about two-thirds of the people in that category are public school, and about 1/3 are private and childcare. And so we're going to try to do a split along those lines in terms of vaccine allocation. We don't know. We're not certain of the numbers yet next week because that really depends on how many vaccines we get this week. Sorry, not this week. That depends on how many vaccines we get next week. We are still vaccinating 75-year-olds. We're still vaccinating healthcare workers. In our conversations with the hospitals, they are now going to be focusing more on vaccinating their inpatients with the range of medical conditions. You may have noticed that the state put out guidelines on vaccinating high-risk hospital inpatients. And so they'll continue to do that. They'll start to really pick that up. They'll continue to do some healthcare workers in 75, but it does mean that they're going to have to focus their energies in more directions now. We're also talking about them with other partnerships, and Arundel Medical Center particularly is working with a number of senior housing to get seniors vaccinated. One of the things that we are seeing around equity issues is that we have lower pre-registration amongst minorities, and that is concerning, particularly because of the disproportionate impact of COVID on minorities. So we've seen from our pre-registration something on the order of 6 to 7% Blacks, whereas compared to the population in the county is about 17%. For Hispanics, it's about 3 to 4%. Population's about 8%. So we'll be talking a lot more next week about what we're doing to specifically address this issue of pre-registrations in terms of who's gotten vaccinated. And remember that cuts across also occupational lines. We see that in our county about 10% of people who've been vaccinated were Black. And about 3.5% Hispanic, about 4.4% Asian, 2% white. Once again, with the disproportionate number of deaths amongst Blacks, that is an area of concern, not just that they're below what we would, in terms of vaccination rates, below what we'd expect from just population, but also that much further below their proportion of the deaths in the county, which is about 25%. So that's definitely an area that we're going to be addressing through a variety of mechanisms. We're discussing that this week. We have our health equity initiative, and also we'll be expanding the number of community sites next week to try to provide greater options for people to get vaccinated. Our biggest challenge is planning, just because we have fewer vaccines this week, and we want to make sure that we are spreading it out amongst communities throughout the county. So we'll have more on that. I believe those are the points that I wanted to cover today. Yeah, I will turn it back over to you, Chris.
Great, thanks. Now we're going to get another brief update from Pam, and after that, we'll take media questions.
Chris, good morning, everyone. Just want to convey to you some of the changes that have occurred this morning, and they're unfolding as we speak. The casino, I'll start with that. We did cover that last night. We had to cancel the AM vaccination appointments. Those were the 8:30 to 11:30 appointments. We are filtering those individuals into the 12:30 to 3:30 and the 5:30 to 8:30 vaccination slots. They have all been contacted by phone and email. Any message I'd like to, for those folks, is check your email. Or if you need assistance, you can call the Department of Health warm line 410-222-7256. So the casino is open, and we just shifted our morning clients into the afternoon appointments. The community college is a little bit trickier. All community college AACC vaccinations have either been canceled or moved to Department of Health. So I'll just go through this systematically. The AM appointments were canceled as of last night. Those individuals have been contacted by phone and email, and they've been given links to reschedule their appointments for Saturday and Sunday this coming weekend. Our 12:30 to 3:30 appointments, we're able to keep those, but we are moving them to the Department of Health at 3 Truman Parkway, the lower level accessible entrance. And those people are getting phone calls and emails as we speak through the different technologies we have to try to reach out to people. And thirdly, our 5:30 to 8:30 clinic is canceled. And those individuals are also receiving a message which will give them a link to reschedule on Monday. So a little bit of some shifting around, but I feel like we've done a pretty good job of systematically getting people back in as quickly as possible. And the best message is have people check their email or call the 222-7256 for clarification on their appointment.
Great, thank you, Pam. Okay, now is the part you've been waiting for, media questions. We're going to handle this two ways. You can raise your hand, the function in Zoom, which will signify you have a question, or please put your name and your outlet in the chat, and then I will try and facilitate and work our way through the queue. But I know first up, we've got Olivia from the Capitol has a question. So go ahead, Olivia.
Good morning, Mr. County Executive. I'm wondering about in Phase B, the continuity of government function for vaccinations. I know that the County Council has offered to make appointments for a vaccine. I'm wondering if you have a plan to get vaccinated and your staff under that phase.
You're on mute there, Mr. County Executive.
Yeah, well, I guess the short answer is when the teachers get done, I'll get done. That once we had an opportunity, a significant opportunity for our educators to get vaccinated, go into the classrooms and teach, then I'll be right behind them in line. Yeah. And in the meantime, I'm being very careful because I'm not vaccinated and doing everything I can to avoid picking up the virus and or spreading it.
What about other members of your staff who would be essential for continuity of government? When will they go?
Don't have an answer on that yet.
Thank you.
Okay, thanks. We got a message previously in the chat from Rob Lang at BAL to Dr. Nalesh. I wanted to know how many were vaccinated at the last minute clinic on Saturday, and were all the doses used, or did any have to be thrown out? Do you know the answer to that, Doctor?
Yep. So first question, about 160 people were vaccinated at that Saturday evening clinic, and no doses were thrown out.
Great.
And I just want to add to what Dr. Kalyanaraman said about that Saturday evening rush. When the decision was made as a result of the weather, that they had thawed these doses and were concerned about how long the storm would last. And that's the kind of thing that government can do. We have the coordination among agencies to bring the people in to do it. And that's the case that we're trying to make to the state, that local health departments really are the ones who were created to do these kinds of vaccination programs. And please don't ask local health departments to stand down right at the moment where we need them most.
Great, thank you. So next question, we're going to go to Mackenzie Frost, WBFF, and then we'll hit Danielle Ohl from the Capitol after that. Mackenzie?
Thank you so much. Mr. County Executive, I wanted to ask you about the allocation for this week. And I know that the Biden administration had talked about giving a boost to states, and we're seeing the state get a boost. But can you explain a little bit more about the communication that you've had with the state, if any, to when you were aware that the county would not be getting a boost in doses? And are you feeling frustrated about that, knowing that some of those doses are going elsewhere?
Well, it is frustrating, and it's not just Anne Arundel County. It's been all the Central Maryland counties in particular. You saw we asked to know further in advance what our allocations would be, and we did get notice on Thursday last week with I believe a phone message of what that would be, and they put out a minimum that all the large health departments could expect, and it was under 1,000 doses. And so, when we were getting 5,000 and we're getting an increase from the feds, you can bet on it that we're frustrated. We believe that local health departments are getting are the most efficient means of getting the doses into the arms of our residents for now. But that as the numbers increase, absolutely we need to bring in pharmacies and as many players and providers as possible to get it out to scale up. But we've used taxpayer funds to create the capacity that we have, and we have sites ready to roll. And so all of the county health departments that have this capacity are frustrated to hear that the doses are being diverted elsewhere.
Okay, thank you. We're going to go to Danielle next, and after that, we'll do Kate Amara from WBAL.
Hi, good morning. I have a question for either the county executive or the county health officer, or both. I think county executive, you spoke a little bit about equity as far as, reaching folks in all parts of the county. From my very, layman's analysis of the locations of the pharmacies, there really aren't that many that are in South County, and really none at all south of Route 214. So those folks in Deal and Shadyside and really far down toward Calvert don't have as much access to Giant or the other chain pharmacies as folks in North County do. Do you have a plan to address that?
South County has fewer commercial establishments. It's rural. So it's more like rural parts of the state and rural parts of the country. So people tend to have to drive further to get to any kind of healthcare or any kind of a pharmacy. There really are very few. Edgewater has some pharmacies, but unfortunately, they're not the ones that are going to get vaccines. There's even a Giant in Edgewater, which is right just north of Central Avenue. There's a Johns Hopkins affiliate health clinic that will be providing some doses, but I believe that will be to their customer base. And there is one federally qualified health clinic, Bay Health, that's in Owensville that, according to state numbers, they get 100. Most of the FQHAs get 100 doses. So there's some, but I know that the health department is talking to some providers and about expanding into South County further. Nilesh, I know that you had one at least in mind.
Yeah, we're looking at South County and other locations throughout the county to replicate essentially what we did with our pop-up testing, to essentially do the same with our vaccination program. So we're looking to have that come online in the next week or two at most. And part of that is our focus on South County. So once we get locations locked down, we'll be able to share them.
If I could add that in the meantime, we have partnered with our Office of Transportation, who are helping people get to clinics, even if they're from the lower part of South County. We can get them to the community college at our Department of Health site. So we're aware of that, and thank you for highlighting it.
Pam, how should folks get in contact with the Department of Transportation if they need assistance?
They can call 410-222-0023 or 0047. And they are prepared to get people from remote parts of the county to our two vaccination sites, or anywhere else they've scheduled a vaccination.
Okay, great. Thank you very much.
Mm-hmm.
Okay, next we've got Kate Amara, and then we're going to go with Rachel from the Capitol, followed by John Frenaye.
Thank you, Chris. I quickly, Pam, when you get a chance, I want to confirm you said the clinic at the casino is open this afternoon. Just when you get a chance, you can put that in the chat. Just want to make sure I heard you correctly. And for the county exec and Dr. K, I'm not sure who can best answer this. County Executive Pittman, you have quite publicly addressed the county's reduced number of doses in the allocation from the state, although I understand this week it was a little bit higher. And other counties have done the same and have seen much larger, huge reductions in the number of doses. are you, when your allocation is cut week to week or reduced by whatever percentage, are you in communication with the state health department about where those other doses are going? For example, do you know if Anne Arundel County in general is still getting the same number of doses, even if they're now divided between some giants in Anne Arundel and the hospitals and other healthcare providers? Do you have any way of knowing if now they're going to the pharmacy network, if they're actually going to pharmacies in your jurisdiction? And what is your advice to your constituents who can't get on a waiting list for a giant Safeway? They just have to, keep logging on and checking. Whereas from the health department, your system, you can fill out a pre-registration and know that you're on a list somewhere for a callback. That was a lot of questions, but I think hopefully you can understand the gist of what I'm trying to ask. Thank you.
Yeah, and it's a really good question, is how do you respond when you get information like that? And, one thing is just to be angry and make a lot of noise about it, but you also have to actually act on behalf of your residents. So what we've done is we started last week to not only promote our own aacounty.org/COVIDvax pre-registration site. We would like that to be the central place for people in our county to go to all of these others, but it's just not the case. So we've started pushing out all of the websites, all the information that we can possibly get as soon as we get it about where people might be able to go. We've started a weekly weekend review on COVID that we put out. We put out the last one on Friday. It lists all those locations. It lists the projections that we have, the notifications that we have of how many vaccines each will have, so people can decide where to spend their time shopping, trying to get through. But there's nothing that we can do other than to advocate. Dr. Kalyanaraman might be able to speak about how it works between the state health department and the county health departments, because they do have some direct communication and what information they get. But he shares that with our office so that we know how to advise our residents, and we know how to shift our allocation of resources in the county. We're not, it's not just our health department that's involved. As you've heard, we bring in folks from other departments to help organize the pre-registration process and stay in touch with those people to try to guide them. When we have to cancel appointments from weather or whatever the issue is. You've hit at the, that's our life the last couple of weeks, and we hope that it will improve. We also have others besides county government that are saying the same thing in the General Assembly. If you heard the hearing with Secretary Schrader yesterday before the Senate committee, they were asking these same questions and pushing as well. And I think we'll get heard eventually. I hope we'll get heard, and that they will start communicating earlier, better, and put more of the emphasis on local government health departments. You have anything to add to that, Dr. K? You're on mute.
Yeah.
And that might be a good thing, but
No, I just said I think you covered it.
oh, okay.
Well, can I just follow up, because I do think it is a fair question to ask. If, and I'm just throwing out a number, if last week you got 4,000 doses, and then say this week it was 50% less, you got 2,000. Is it communicated whether those other 2,000 are going elsewhere within the county, so that maybe a resident, who's 50 and in great health won't be getting it soon, but maybe, if you're an inpatient at the medical center, or, so that that those doses are still coming to your jurisdiction, even if they're not coming directly to your health department? Do you know if that ratio is remaining the same?
They say it is, but I don't believe it is. I have heard the health department they said in the hearing yesterday that when they take them away from a county's health department, they're making up for it elsewhere. But if you do the math in our county, it doesn't add up. And they don't share for the for the pharmacies, location by location allocation. So we did not have the numbers for Giant. The only one of those that has locations listed in our county of the pharmacies, Giant. They did not share their allocation in advance when they shared the allocation for hospitals and health departments. We then found out, that it was 5,000 for the state, and that it'll be 10,000 for the state. That's the only information that we've been able to get. So we do have difficulty figuring out what's coming to our county. Now, it's possible for our residents to register in other counties through pharmacies, but we would like to know whether it's equitable county by county according to population. And I believe it's not. I believe that the large central Maryland counties have had their allocations reduced when you combine those sources.
Dr. K, what about in terms of the hospitals and other large healthcare providers? Do you know if doses that may not be coming to your department or if they're going to Anne Arundel healthcare providers elsewhere?
Yeah, we don't get an accounting in that way at a county level. What we have visibility on is what the health departments are getting, what hospitals, the federally qualified health centers, but as the county executive noted, we don't know how much is going to each of the retail pharmacies, and that's growing, and we don't know how much is being allocated to the mass vaccination sites. So we only have a partial view of where the doses are going.
Okay, we've got not a whole lot of time left, so we're going to do two more questions. We've got Rachel from the Capitol and then John Frenaye to close us out. Go ahead, Rachel.
Yeah, and to make my question just even shorter, I'm just wondering if special educators are going to be given any kind of priority, given that, they could be back. I mean, I don't want to jinx anything, but theoretically, in the coming weeks, if the case rate drops below 15.
I take it that's to me. Do you mean in terms of vaccinations or something else?
Oh, I'm so sorry. Yes, in terms of vaccination, if there's going to be any vaccination or priority given to special educators within the pool of teachers.
So that's the prioritization for ACPS is being done by them. So I will defer to Bob on that if he's here.
I can answer that. Thanks, Dr. Kalyana. Rachel, yes, we are developing a prioritization list for our employees based on when they might return to classrooms and or schools and their contact with students, the amount of contact they have with students.
Okay, sounds like you're good, Rachel. So we'll go to John Frenaye to close us out.
Just real question. With the lack of communication between the state and the pharmacies and the county and everything else, is this just turning into a chasing windmills type of a situation, trying to figure out how many people are actually vaccinated in the county? I can go to Six Flags if I'm in a 1C group and get vaccinated. I can go down to Calvert County. Somebody that lives in South County can go down to Calvert County or St. Mary's County and get vaccinated. I can go to Giant and, it seems like there's just no communication between all the different people. I mean, how is the county actually determining who's been vaccinated and how can you actually say X percentage has been vaccinated?
So we are able to pull data from there's a database called Immunet, which is used to capture vaccinations. It's been used for a long time. And the COVID vaccinations go into that system as well. So we're able to pull data out of that which is why you see the data on our website that says, this many residents have been vaccinated.
And while the communication between our team and our two hospitals is regular, ongoing, and outstanding. I mean, you saw that when one hospital stepped up with doses to fill for ours, and then I believe it was just yesterday. Today's Tuesday. Our team met with the leaders of the pharmacies and started that dialogue. I think they were hoping we'd transfer doses to them, and we were hoping they transfer doses to us. At least we want to coordinate, but that conversation has started. It took some time to even just figure out who to talk to. So we're talking to them. But our request to the state has been to allow local health departments to coordinate among the providers in their counties to make sure that the right people are getting vaccinated, and that hasn't been granted that authority.
Mr. County Executive, is that a request on behalf as well as the other 8 large municipalities within the state? Are they all on board with that?
We have not done a joint letter as we have done on many other things recently. We may do that. It was in my written communications in advance of the meeting with the governor, and that was one of our requests. It was also something that I think some of the senators talked about in the hearing yesterday. So it's on the table.
Great, thank you.
Okay, I think we're good. Thank you, everybody, and we will see you next week.